Hey there, ladies. Welcome to Wellness Wednesday. How's everyone doing tonight? Hopefully, everyone's doing well. Let me make sure my volume's down as usual. Always have to make sure of that. Everybody hear me and see me okay? And welcome to all of you, especially welcome to all of you new ladies joining us for the first time for Wellness Wednesday, new to the group as well. I know we've welcomed many of you over the last few weeks. So, welcome to you. And I'm being told everything's good to go. So I will say my disclaimer while we're waiting on any stragglers that want to join us. First of all, anything that I say during this Wellness Wednesday is not health advice, it is health information. And if, don't stop taking, change the way you're taking any of your medications. If you feel like you need to do that or should do that, please first consult with your prescribing practitioner to help you do that. And by attending tonight's Wellness Wednesday, this does not establish a doctor-patient relationship. So there we have it. Tonight's topic is huge. How safe are all these new weight loss drugs that were meant, first of all, to treat diabetes, right? So you're seeing a huge growth in popularity with these GLP-1 agonists, is what they're technically called. A lot of, you're seeing a lot of positive reports in the media and advertisements for these and gosh, all the health benefits they seem to have. But I also get a ton of articles in my feed about all the side effects and the negative health effects of these drugs. GLP-1 stands for glucagon-like peptide 1. Now, just another kind of a disclaimer here. Those of you who are seriously considering whether you should use these or not really need to listen up tonight. I'm going to get a little technical because I think the more you know and the more I can help you to understand, the more equipped, the better you are equipped to to make a decision that is actually right for you in terms of what you need to do for your body. And so these these GLP-1s, they're most often referred to as a gut hormone, but it's also a neurotransmitter. In other words, it's a chemical that acts on the brain and nerve tissue. All right. So keep this in mind. I believe that these are more dangerous than beneficial because of their neurotransmitter effects. So it's important to know there's a difference between hormones and neurotransmitters, right? So again, we're going to get a little technical. Hormones are secreted from an endocrine gland like insulin from the pancreas, right? Thyroxine from the thyroid, or cortisol from the adrenals. Okay, just to give you some examples. Neurotransmitters are molecules that are produced in the nervous system or by gut bacteria that send messages to, or let's say that they act on the nervous system or brain and nerves. Okay. Throat's a little dry tonight. Um, so GLP-1 acts like a hormone in the gut and as a neurotransmitter in the brain and at the vagus nerve. Right? Some of you have heard of that one. So it's an important one. The vagus nerve sends messages from the gut to the pancreas and to the brain. Okay. Now, GLP-1 is also made in the gut, and it signals what we call the first phase of insulin secretion, which accounts for 70% of insulin release from the beta cells of the pancreas. Okay. Now, GLP-1 is also produced in the brain for different purposes as it responds to insulin, ghrelin, a hormone, our hunger hormone, and leptin, which is our satiety hormone, or tells us we're full. This all leads to slowing digestion to get the most out of our food, and achieving eating satisfaction, and causes us to stop eating, right? Now, our native GLP-1 has a very short window of time to help this to happen. Usually only about 2 to 3 minutes in the blood is all it lasts. And this limits what we would say crosstalk or the gut's direct influence on our brain, which might change these effects. Keep in mind, if it has more time to act, all right, if it hangs around longer than a couple minutes, then it's going to change our brains even more. Now, you might have heard of this one, Trulicity, Victoza. These are the older ones. They were some of the first. Saxenda, all right? These are some of the first. Then more recently, and you may have heard of this, semaglutide or tirzepatide, and these are more commonly known as Ozempic, Wegovy, Mounjaro, Zepbound, okay? Now, the main issues with these drugs, as these drugs flood our system with synthetic high doses of these long-lasting mimickers, that's what they are, is mimickers, and build over time to unnaturally high concentrations as their half-life is 7 days, not 2 to 3 minutes, okay? So why these drugs are dangerous and what causes their ill effects. So first of all, they mimic the effects of our own GLP-1 hormone, which slows gastric emptying and reduces appetite and improves, like, this is the benefit, right? Improves blood sugar control. Okay. But think about how long it's lasting in your system. We'll come back to that. They're said to be effective for 10 to 20% of weight loss and cardiovascular benefits as well. I mean, they sound really good. But I'm going to discuss why they have risks and why they're dangerous. And these risks are certainly underemphasized because they are far more serious and consequential in the long run. And they're more common than is being reported. Now, I would think that if you were truly concerned about your health, you wouldn't want to roll the dice for the chance of having these side effects. So let's discuss some of these. GLP-1 agonists commonly cause gastrointestinal issues, right? Like nausea, vomiting, diarrhea, and constipation, but they're usually temporary. Less common but serious effects can include pancreatitis. Okay, so let's look first of all how this happens, right? To cause significant inflammation of the pancreas, and you often get severe abdominal pain, gallbladder problems, and bowel obstruction, where your bowel can't, it just stops functioning. It can't move things through. As we flood the system with synthetic high doses of this long-lasting medication, remember, it lasts 7 days, not just 2 to 3 minutes. It artificially stimulates the pancreas to secrete more insulin. And this results in artificially lowering blood sugar and stressing the pancreas big time, to the point that it swells with inflammation and can cause acute pancreatitis. Okay. If any of you have had it, it's really not fun. Now, as an aside, when people with severe diabetes begin taking insulin, right, the injections, their overall mortality risk increases significantly, ladies. I don't see a difference between this bullying of the pancreas with these drugs to oversecrete insulin and giving someone insulin in treatment. Would it not create the same risk? Would it not increase your mortality risk? Yeah, I think it would. Now, synthetic GLP-1 agonists, which can persist in the bloodstream, again, for weeks, overwhelms the brain when it's in such high concentrations. So this unnaturally high level signals the brain and other hormones, causing the person to feel extremely full, similar to, after eating a large meal, Thanksgiving dinner, how you feel like, oh, This strong signal slows gut emptying, digestion, and appetite, right? Leading to nausea, vomiting, and gut distress. All right, now, consequently, the person develops an aversion to eating and food, resulting in weight loss. Wow. Wait, including muscle loss. Clinical trials indicate that 38 to 40% of weight loss achieved with Ozempic is lean body tissue, while data from other, medical weight loss centers suggest that up to 50% of the weight loss is muscle. Ladies, this is concerning. Do you really want that to happen? When we administer this drug to the entire body, we bypass natural food responses and regulatory mechanisms. And this causes literally normal brain pathways to shrink and dysregulate, potentially causing permanent damage. Now, the vagus nerve is the main pathway that helps control the body's relaxation response, right? And it checks the sympathetic response, right? So if this nerve and the relaxation response don't work properly, the stress response can become too strong and unbalanced. And this shift is dangerous and it impairs healing and repair. It promotes an exaggerated stress response and interferes with skeletal muscle repair. Okay, so this, in other words, means that your body's breaking down your muscle. And if a person loses, say, let's just give an example, 50 pounds on this medication, 20 to 25 pounds of that 50 pounds is muscle. So how many of you would be okay with that? Yeah, I'm not going to ask you to raise your hands or anything. When weight gain occurs after you stop the medication, 100% of that weight gained back is fat. So that's a really nasty trade-off, if you ask me. All right, now another recent article cites multiple cases of gastroparesis, which is where um, it's where you stop moving, where your stomach doesn't empty, right? It's impaired. And this article, let me kind of go back to my thinking. This article, it explains how it's ruining lives. All right. Now I know this is an article. It's not necessarily a study, but it's saying how this is ruining lives, causing cyclical vomiting syndrome. Okay. Where, some people, and mostly women, can't even eat a little bit before it comes right back up. And of course, this has other consequences, like I was just talking about with muscle loss. So we can have there's other concerns with this too, like hypoglycemia, where, okay, so if you're not eating and you're not emptying your stomach and you're not even able to get nutrients in, you're going to get hypoglycemia, so low blood sugars. Now, especially if you're taking other diabetes medications. So for you diabetics on these drugs, your risk for developing hypoglycemia is much worse. Potentially kidney damage, or you can get allergic reactions, right? And increased heart rate. Now, the effects of this problem, this gastroparesis, includes notable muscle loss, right? This can cause heart muscle damage. It can cause nerve damage as well, and severe depression with suicidal thoughts, which that brings me to the mental effects, the health effects on your mental well-being. So many are reporting negative side effects with this, and a recent article also reported severe mental health consequences relating to these drugs. So again, because they're synthetic formulations, they have more of a neurotransmitter effect than a normal GLP-1 does, because again, it's flooding your system with this unnatural, abnormally high level and it's staying in your brain longer, and it's going to have detrimental effects. There was a study, the it was reviewing the European Medicine Agency's system for managing and reporting side effects, looked at like over 30,000 reported adverse events, and found almost 500 of these events were adverse psychiatric episodes in total. All right, meaning, you know, suicides. Uh, According to the study's findings, women made up, somewhere around 60-65% of the reports, and men accounted for maybe 30%. And and I remember it saying that fatal outcomes were predominantly among men. So it's like 8 out of 9 or so resulted from completed suicide attempts. So obviously, depression was a big consequence of taking these drugs. This is a serious matter, right? Um, it's in fact, you may know that Europe doesn't even allow the prescription of these drugs for weight loss. They won't allow it. Now, how this affects blood sugar. So again, it forces the pancreas to release more insulin, right? And so when you release more insulin, you're going to lower your blood sugar artificially, right? Okay. So this is going to have consequences. And and one of the effects of these drugs is that they can increase what we call keto acid release from the fat, right? This is a complication, um, and it's mostly with like Mounjaro and Ozempic, and they've been linked to many deaths. Okay, um, in alone in the U.S., right? So normally the body breaks glucose down, right? Sugar breaks it down, and it converts it into energy. And when the body doesn't get enough, it breaks down fat stores as backup. And this reaction, chemical reaction, produces ketones as a byproduct. And this could be more likely in patients taking GLP-1 agonists like Ozempic or Mounjaro, because these drugs suppress the appetite, meaning patients don't get as much fuel, from their food as they need, and then they go into starvation mode. Then ketoacidosis is what you normally see in diabetic patients because their bodies can't produce enough insulin, which helps convert, food into energy. This causes them to break down fat instead. Normally, this would be okay if you weren't also losing muscle and decreasing nerve function. Okay, so the symptoms of this include thirst, like excessive thirst, frequent urination, vomiting, stomach pain, weakness. Certainly could get short of breath, confused, might get fruity smelling breath, right? This is because ketoacidosis produces high levels of the chemical acetone, which has a distinctive fruity odor. Okay. Now, left untreated, ketoacidosis can lead to low blood sugar, brain swelling, and death. Okay. Now, I want to show you something here real quick. And I apologize that this only goes up to 2023. It's a bit outdated, but I need you to understand that it's not getting better. Okay. So we see these, from 2018, these deaths linked to these, to these drugs, and versus 2023, I think these speak for themselves. Now, while these are largely anecdotes, would you want to be one of these patients, right? Patients told I believe it was the Daily Mail, that they suffered from organ failure, stomach paralysis, this gastroparesis, and suicidal thoughts. Now, they included a mother who suffered kidney failure on her daughter's birthday, and a man whose sister begged him for like the third time to not attempt suicide after Ozempic ruined his life. The You don't want to be one of these people, right? Even if these are anecdotes, you why would you want to be why would you want to roll the dice? They also don't even work for some people, you guys. This is, there's a wide variation of, weight loss with these types of drugs. Now, doctors will say roughly 10 to 15% of people who try these are non-responders, typically defined as those who lose like less than 5% of their body weight, right? These patients, doctors say, don't experience enough appetite reduction to result in significant weight loss. And if you attended the master class, you would have heard me talk about the fallacies of the weight loss industry. And one of those is appetite reduction. Yes, while it can lead to weight loss, it leads to muscle loss. And then any weight you gain back when you start eating again is fat, just like I mentioned. So doctors believe that some patients might be resistant to these drugs, whatever. Other possible reasons could be certain medical conditions and other medications, how much a patient, a person, how much they had lost before taking the drugs. Difference in how, people can metabolize these drugs can make a difference. But, several studies show that these drugs may lead to, um, these really, I would think, obviously unwanted side effects. One even showed they may lead to surgery complications like aspiration pneumonia. Okay. All right. So, in my opinion, these drugs are very dangerous. They do nothing to address the root causes for why you have a weight issue in the first place. And they certainly cause more stress on the body and harm to your organs and cells. And you have to be on them for the rest of your life, or you will gain the weight right back. And you'll gain it back as purely fat, right? Okay. So I wanted to give you the truth about these drugs and really to help you make an educated decision if you're considering taking these prescribed by your doctor. Now, I do have a few questions, I think. Let me just double check with Cherry Ann. Let me see if we've got any questions. Okay. Is it common to gain all the weight back after going off the drugs? It is very common. And like I said before, it's common to gain it back. You won't gain the muscle back that you lost. Up to 50% of what you'll lose will be muscle. And it'll all be fat that you gain back. And it is absolutely common. I have a good friend who feels awful taking it. She's dropped a lot of weight, and you can tell that she's dropped a lot of muscle. I noticed she even had a hard time getting up off the floor, and she's younger than me. And that's not good. That shouldn't be like that. She shouldn't have trouble getting up off the floor. But she says that she can't stop taking it or she'll gain it back because she tried stopping and gained 25 pounds back within just a couple weeks. And she was like, well, I got to go back on. I got to take it. And it hasn't helped her really even lose that much back, off again. And there she's stuck. She's really stuck. And I just hate seeing her like this. She's a dear friend, and friends don't always listen to you very well, but I just feel so bad for her. Is it bad for diabetic or only non-diabetics? It's bad for everybody, you gals. It's bad for everybody. But especially if you're taking diabetic drugs in addition to these, it causes you, like I said, to be more prone to hypoglycemia and the uh, the effects of that, uh, even to where you could develop, ketoacidosis, and you can go into a hypoglycemic coma. So How do these drugs affect the thyroid and Hashimoto's? So, funny enough, recent studies also show that there's an increased risk in thyroid cancer in taking these drugs. Um, when you develop more insulin resistance, because this is forcing your pancreas to produce more insulin, you get more and more resistant to the insulin, and this feeds the autoimmune Hashimoto's fire. It causes your immune system to attack. And so the more aggressive that attack is, the worse your thyroid's destroyed and you make less and less thyroid hormone. And so there's this connection. They definitely worsen that toxic interplay between the the insulin resistance and the Hashimoto's. Yeah, they just make each other worse. You said that the drugs break down muscle. What about the heart? I did mention that. Yeah, it can even cause problems with heart muscle breakdown. And it's interesting, even though they're saying that these have positive cardiovascular effects, they're only saying that because they're making your blood sugar reduced artificially, which they always say is good for your heart. That's why they're making that jump. They're um, extrapolating that only, and a, it's not even a proper extrapolation. Um, it's that's not going to make your heart stronger by taking these. Can negative symptoms or effects on the body be reversed? Like I said, some of these brain effects cannot because you literally lose these connections and it can damage the nerves permanently. All right. In fact, my same friend, it caused her to have carpal tunnel syndrome, and that's not gonna reverse. She had to have surgery to release the tendons holding her, carpal tunnel in, so that she could get some relief. And even then, it hasn't helped that much. Is Mounjaro good to take as a diabetes drug? I'll be honest, I am not a fan of these at all. All the diabetes drugs are doing is artificially lowering the blood sugar. High blood sugar is a symptom of other things going on. These will not fix diabetes. They will ultimately make it worse over time. They have not had these long enough on the market to see. Um, I've been in medicine long enough to see and to have seen some effects, negative effects of these drugs like Trulicity and Victoza, and they have similar effects. Diabetics who take medications live 10 years less on average. You can't tell me that these drugs are doing anything truly to benefit diabetics other than artificially lower the blood sugar. And in fact, it becomes to where they're not even doing that. Okay. I've seen too many patients progress from, just beginnings of diabetes to end stage disease. And they usually succumb to the complications of this nasty, nasty disease. Now, the good news is type 2 diabetes can be reversed. And if you get the right tests, just like I've said with the thyroid, if you get the right tests, comprehensive testing, we can work to reverse it. And we can, because if we find the root causes for the insulin resistance and type 2 diabetes, then we can reverse it because we can fix those issues. We can address those causes, those triggers. Okay. Husband on Mounjaro along with Jardiance for diabetes helps his blood sugar and A1C. Yeah, of course. It artificially lowers the blood sugar. That does not mean that his diabetes is fixed. I am not going to recommend that he do anything because I don't have a doctor-patient relationship with him. I was asked if he should discontinue Manjaro. I can't tell you that. Okay. I can give you information. You can go back to your practitioner and be a little more equipped to discuss this very important topic because he can't afford to lose muscle either, can he? All right. So I can't give that advice, but I can give you information. Okay. Do we have any more questions? Terry Ann's going to let me know. Because when you guys comment, and it's awesome, you comment, and your comments are wonderful. I miss them. They go too fast. So let me see. I mean, I think that's pretty much wrapped it up. But ladies, this is important information. And thanks for joining me tonight to hear it. I look forward to sharing more information with you next week and throughout the week as I pop in and answer some questions that I've been doing periodically here. Just remember, have hope. There are things that we can make the right decisions, right? Oops, one more question. My opinion about metformin. So while that's a half hour's topic in and of itself, if not more, metformin is still going to only artificially lower the blood sugar, and it can have ill effects on the tissues because it keeps the sugar from going into the bloodstream, mostly in your liver, and it can impair liver function and kidney function as well. And it's just, again, like I said, artificially lowering the blood sugar, and it's not solving the problem. And it can have a lot of side effects as well. It can have a lot of GI side effects. The best thing is to get to the root causes. Get comprehensive testing done so that you can figure out really what's going on causing these issues so that we can work to reverse them. So have hope, ladies. There is absolutely hope, and we've helped thousands reverse their issues and bring their autoimmunity into remission. So thanks for joining me. And remember, you still have the power to heal. Take care, everyone. Have a good night.